When I hear MRC or Muslim Resource Center, I immediately have a positive and relaxing kind of connotation, feeling. And I think it's a testament to not only a relationship, but the sense of collaboration and partnership that we enjoy with MRC. Mohammed and the staff have been extremely supportive of our staff and working with families, generous with their time, and leading edge, really. So they're a strength for us and they're a strength for our community.
The clientele that we see here are not reflective of London's community, so we've been very blessed to have the partnership with MRC and Sahar specifically for helping facilitate access to services, but also really helping increase our capacity here as a training clinic for our future psychologists to provide culturally integrative care.
Within the Muslim community, something like, for example, family violence is a new concept. People think if you have a problem in the family, you can solve it or resolve it within the family or maybe within the, your community, and they don't necessarily look for professional help. What is unique with MRC's actually approach, we created a different model of responding to family violence. We call it culturally integrated family safety response, which really means, we actually through this approach, we would be able to reach out to especially women who maybe are experiencing violence, but they are not ready to ask for help.
I know there's a lot of research that happens at MRC as well. Because of their frontline experience, they will see things that I don't necessarily see. Like, I see the worst of the worst cases when they've arrived to the hospital, right? I don't see people in their homes. I don't see people on the street corner. And oftentimes the cases presented are literally that. Like, a member of the MRC is out at the street corner talking to the individual there and trying to get them access to healthcare. When it comes to supportive therapy, these services are best delivered in the person's native language, in their strongest language.
Personally, when I meet with Mohammed and the staff there, I always walk away with a warm feeling. And that's been good for my soul. And I think, well, this must be how families feel when they're scared, when they feel there are organizations involved in their life, like Children's Aid Society, what's going to happen to them. To know that there's that kind of concern and generosity and support, I think just must be life-changing for them.
The work that MRC does is with an entire family, and we as ANOVA work with the person who has been abused, whereas sometimes it's important to work with the entire family, which that's something I really truly appreciate. The more opportunity that you're able to have, the Muslim Resource Center is able to have to reach more families is so important and so vital for this community. We
de-escalate conflicts that could lead maybe to severe violence, also maybe to really exhaust the system, like really involving the police, the Children's Aid Society, the court system. Imagine how much that will cost if you have all this, organizations are involved in one family, but also really how that would be pressuring the family.
We know that our clientele come in often with very complex needs and intersectionalities, and that often one organization alone is not able to kind of do the work.
Since the day I was married, I was told I was not allowed to have a cell phone or internet. He pulled me out of my career and he started selling drugs to support the household. He went against everything I believed, but because of the society we live in, I was afraid to get a divorce. Later on, I was abused physically to the point where I had to seek medical professionals numerous times. I was also abused mentally, calling me names I have never been called in my life. He used the religion as a tool to his advantage and told me that in Islam, a woman is to obey a man and do what he says. I somehow, through the links, got in touch with the Muslim Resource Center. I was at the lowest point in my life, and I wanted to speak to someone who can relate to me. Through the sessions, I started to distinguish the difference between culture and religion. What I went through in my life was not easy, and still, until this day, I continue to struggle. The one thing I would like to highlight to our community is it's okay to be a powerful, successful woman. It's okay to socialize. It's okay to stand with confidence because everyone has that in them. What is not okay is being abused and helpless. Hasna, my social worker, she highlighted all my strengths. The only negative thing I can say about the Muslim Resource Center is that I wish I would have heard about this sooner. I had no idea our community offers this service, and this has helped me emotionally. The reason why I went into detail with my life is because abuse is everywhere and very common in our community.
Anytime an incident happens in any community, there's this ripple effect. And that ripple effect affects people that might not even be close to the person that directly was affected, but they're impacted. And when we don't have the opportunity to be able to speak and talk to someone to just let it all out, then it piles up inside. And we know that when we're severely stressed or when there's trauma that occurs that we're not able to release in some way, it ends up with physical symptoms, right? It ends up with mental health issues. And then when those issues happen, then there's another ripple effect that affects the community.
So MRC has been part of our learning journey as an organization and a practice partner in making it so. And I think some of the public awareness and education forums they've had have been really instrumental in encouraging others to think that way. And when they do, people get on board, and that leads to tremendous collaboration for services for families.
Enhancement and development of programs, and I think the creative kind of partnerships, and I think perhaps kind of like all nonprofits, but including ourselves too, just the awareness and resources to be able to continue to do the great work that they're doing.
We often will refer people to anger management through different programs at CMHA or otherwise. We don't have enough language-based services in London.
The growth has been extreme. More staff have been added on. Lots of families have been able to access more educational workshops. The list goes on.
I think the gap is, the lack of awareness that we may have had previously about the importance of understanding trauma, migration, all of the horrors people experience and the persecution. Just getting here, to really think about it is staggering. So I think that sense of awareness and then knowledge and then encouraging our own humility to find out who is the person that we're working with and who am I and what bias have I had and how do we work together. I think that's the gap that this has really helped to fill for us.
It's been nice to be able to work with people who have a genuine care for their community and really want to support, and I am very much about that.